Hello everyone, it's your CEO, Robert Moranville, and I wanted to make this brief video about our new electronic health system that we purchased for ABC Clinic. So I received a lot of emails from you guys, questions, concerns, excitement about the new system, and so I wanted to make this video because I can tell that you guys really care about your patients. You really care about the new electronic health record, and I want to set a few things straight for you guys and maybe put your minds at ease a little bit. So the first part of the system that I wanted to go over is called the patient health record. So this is a great part of the system, and one of the things that is so great about it is the fact that it's untethered. So what does that mean? That means that the patient can take their health information anywhere they want. They don't have to stay within our system. They can take it to a specialist. They can share their health information with their family. They can take their health record to any testing appointment that they have, however they see fit, because it's their health information. And this creates a more engaged patient. So the benefit for us that it's untethered is that we can send that information for them anywhere that they need. So if the doctor orders a test, then we can relay the patient's health data electronically to whatever facility is doing the testing, be it the hospital or another clinic. We can relay that information to specialists. Wherever we need it to go, we can send it with just the click of a button. The other great thing about this system is it's fully integrated into a scheduling and communication tool. So we can easily schedule the patient's new appointments. We can schedule appointments with other facilities in agreement. And the patients are also able to communicate with their doctors electronically, with their nurses, and we're able to communicate with each other inside the health record. The system also allows prescription refills to be done without having to bother the doctor or the nurses. The patient can enroll in the RX refill program, and if all the proper paperwork is on file, it's as simple as clicking a few buttons on their phone and they can get their prescriptions refilled in a very timely manner. So this means that for us, no more printing out and faxing health records. And this means that not only is it going to be quicker, but their data is going to be more secure because we're not going to have to fax the record and hope that we didn't accidentally key in a wrong number. So the next point that I wanted to make was about social media and how ABC Clinic is going to start using social media to help engage our patients and to help foster communication between them and between us. So first of all, we're going to broadcast all kinds of different health alerts. For example, when they should get their flu shots, if they're older patients, when they should get their pneumonia vaccines. If we're going to have a health fair, we're going to put that on social media. We also are going to put things like new equipment. For example, we got a new pulmonary function machine, and we want to make sure that our patients, if they need to have this test, that they come to us, and they're going to know that we have the equipment because we're going to put it on social media. Another great tool is introducing new providers that come to the area. Patients don't have to worry about a cold meeting with a provider because they've already met the provider many times on social media. The next social media tool that we're going to integrate into our system is a professional one, which means that we can talk to each other. We can also bounce questions off other providers in other areas. There's hundreds of other providers in specialties such as gastroenterology that we don't have here. So if we have a patient that has a gastroenterology question, we can ask that question of a professional in another location, and the patient doesn't have to make an expensive get an expensive referral to gastroenterology if it's not really indicated. Lastly, we can invite our patients to join social media groups that are based on their illness. So if a patient has diabetes, they can join a support group and learn what their peers are doing to help manage their disease. And they can also know that they're not alone in going through their disease. Lastly, I wanted to go over some new mobile health tools that we have at our disposal now that will connect seamlessly to the electronic health record. So we have these glucose monitors that the patient wears, and it takes samples and it automatically sends them to the patient's health record. If their glucose samples are way out of trend, then the system automatically alerts the doctor to the fact that their blood glucoses are out of trend, and the doctor can make the proper medication adjustments, or we can talk about diet adjustments or whatever needs to be done to help get the patient into proper management. Next, we have Holter monitors. These Holter monitors can be worn for patients that are concerned about their heart, and they're connected to the cellular network. So if the patient has a cardiac event, even if they don't realize it, that event can be broadcast over the cellular network to their doctor, and their doctor can see those results and make the proper diagnosis or medication changes so that patient stays safe. A last example would be a blood pressure tracker. So patients can keep track of their blood pressures, which creates an engaged patient, and also it creates a trend of data in their health record, so that if the patient's blood pressure is really high or really low, the doctor is alerted to that as well. Another great tool in mHealth is health applications. So, for instance, we don't get to spend as much time with our patients as we would like. The average appointment is about 15 or 20 minutes, and frankly, that's not enough time for patients to learn all the things they need to know to manage complex disorders such as diabetes, heart disease, and COPD, to name a few. So these health tools can be assigned to the patient, and they can learn about their disease and how to best take care of it on their own time. They don't have to come to the doctor to learn about their disease. They can learn about their chronic illness from the palm of their hand. As an example, COPDers can learn how to take all their different inhalers. They can learn how to purse, lip, breathe, and they can learn about resources that are disease specific, like pulmonary rehab. Lastly, these new mHealth tools are great for helping patients make behavior changes. For instance, we want as many people as possible to quit smoking. So in conjunction with our tobacco treatment specialist, they can sign up for an app that will give them encouragement, keep track of how many days that they've been smoke-free, and send coping mechanisms to them over the cellular network straight to the palm of their hand. They can receive constant encouragement, and if they need to call someone, or if they need to talk to someone about their smoking, they can text over the app to a tobacco treatment specialist that can help them if they're having a really tough time making that change. Another example of behavior change would be diet changes for our obese patients, diet changes for our diabetic patients, diet changes when it comes to managing salt intake for our patients that have congestive heart failure, just to name a few. So I hope that this video was enlightening And I hope that you guys are as excited as I am about this new electronic health system and all the benefits that it's going to bring to our patients. If you have any questions, please feel free to come to my office. I'm always available. My door is always open. Have a great day, guys, and keep taking excellent care of our patients.